We found that more than 40% of the respondents in our survey reported that they had engaged in some form of misrepresentation or had not followed through with public health measures during the pandemic. And what we found was that the most frequently reported types were that people were either overstating the preventative measures such as masking or avoiding large crowds that they were taking when talking to other people that they were either with in person or about to be with in person. We also had people who said that they had not followed the quarantine guidance. Some people had avoided getting tested when they at least had suspected COVID or knew they had COVID. And we also found that people were not mentioning the suspected or confirmed COVID infection diagnosis when being screened to enter a healthcare provider's office. So the most common reasons in our survey were that people really wanted life to feel normal again, and people also saw this as an opportunity to exercise personal freedom. A lot of people also reported that they felt like it was no one else's business, the information that they were asked to provide or the things they were asked to do. We also had some people who felt that the measures were not proportionate with how they felt, so that they didn't feel very sick and therefore felt the required preventions were not proportionate to how they felt. We also had some people who said that they felt that COVID was not real or not a big deal, which I think really highlights an area where we can provide better health communication going forwards. We know that public health measures against COVID work, but we also know that they can be really burdensome to some people emotionally, physically, as well as financially, which is why some people may engage in these types of behaviors. Unfortunately, we know that doing so can have significant consequences on others, particularly in cases where people might therefore be put at risk of getting COVID without knowing it. This study really helps give us an idea of how frequently people may engage in the behaviors and their reasons and motivations behind why they would do so. Knowing this is really important for not only assessing how effective these public health interventions are, but also helping us work towards addressing the concerns and reasons that people have for not wanting to follow these preventative measures, which will allow us to better handle pandemics and outbreaks in the future.